Diastasis recti is a split between the left and right side of the abdominal wall. This occurs in 100% of women at 35 weeks pregnant. While most of them resolve on their own, some of them do need to be addressed. Diastasis recti is really easy to assess on yourself. I did it on myself after my last child, and I did have a split. I was able to correct it with a few simple exercises. I'll show you how to check your own and a few safe exercises that you can start. Find your belly button, and then you're going to palpate up the midline or the center of your abdominals. Push in gently, and you're going to curl your shoulders up. This will cause a contraction of these abdominals and enable you to feel a split. You're going to palpate up along towards your rib cage and then down below. If you do feel a split, you can turn your fingers horizontally to see how far across it is. 2 centimeters or greater is considered significant and something that you should have checked out. If you do happen to feel a split, you're going to put your fingers on either side of the split. Think of your abdominal muscles pulling apart this way, and your fingers are going to push them back together. So kind of get in there and push them together, and then you're going to do a little abdominal contraction. This will engage those muscles. I also recommend doing a Kegel contraction prior to that. That recruits your pelvic floor muscles as well. So Kegel contraction, push the muscle fibers away, let your knees fall out. Then try to use the same Kegel contraction and core to pull your knees back together. You should feel it working down through here. Another safe exercise to do is, again, approximating the 2 sides of your abdominals, Kegel contraction, tight core, and slowly straighten one leg out. Hold for 5 seconds if you can, and come back in. Do the same thing on the other side. The next exercise that you can do is, again, approximate tight core Kegel contraction, and this time just bringing a knee up and coming back down, and again on the other side. Same count, 10 times, take a break, and then 10 times. If these feel good, you can do the same thing again, same setup, and bridge up off the table and come back down. If you're unsure whether you do have a split, or you're having pain or difficulties with any of these exercises, feel free to come see me in the Freehold office for any further guidance.